Understanding vaginal discharge, a natural process. Vaginal discharge is a topic that often comes with a lot of questions and sometimes even concerns. But it's important to know that this is a completely normal and natural part of a woman's reproductive system. Vaginal discharge is a normal bodily function. It plays a crucial role in maintaining the health of the female reproductive system. The discharge is produced by glands located in the vagina and cervix, and it serves several important purposes. It's something most women experience throughout their lives. The amount and type of discharge can vary depending on factors such as age, menstrual cycle, and overall health. For instance, during ovulation, the discharge may become clearer and more stretchy, while at other times it might be thicker and white. This discharge is produced by glands in your vagina and cervix. These glands secrete fluids that help to carry away dead cells and bacteria, keeping the vagina clean and preventing infections. This is a continuous process that ensures the reproductive system remains healthy. It serves an essential purpose to keep your vagina clean and healthy. The discharge acts as a natural lubricant, which can help to prevent irritation and discomfort. It also plays a role in maintaining the pH balance of the vagina, which is crucial for preventing the growth of harmful bacteria. Discharge helps to remove old cells and bacteria from your vagina. This natural cleansing process is vital for preventing infections. By constantly flushing out unwanted materials, the body ensures that the vaginal environment remains balanced and healthy. This natural cleansing process is vital for preventing infections. It's like having a built-in defense mechanism that works around the clock to protect one of the most sensitive and important parts of your body. Without this process, the risk of infections and other complications would be much higher. Think of it like a self-cleaning system for a very important part of your body. Just as you wouldn't ignore the maintenance of any other essential system, it's important to understand and appreciate the role of vaginal discharge in maintaining reproductive health. Understanding what's normal for you can help you identify when something might be off. Changes in color, consistency, or smell can be indicators that something isn't right. It's important to pay attention to these changes and seek medical advice if you notice anything unusual. It's important to remember that every woman is different. What might be normal for one woman could be different for another. Factors such as hormonal changes, diet, and lifestyle can all influence the nature of vaginal discharge. What's normal for one woman might be slightly different for another. This is why it's crucial to understand your own body and what is typical for you. Keeping track of your discharge patterns can help you notice any deviations that might require medical attention. Don't be afraid to discuss any concerns you have with your doctor. Open communication with your healthcare provider is key to maintaining your reproductive health. They can help you understand what's normal and what might be a sign of a potential issue. They can provide personalized advice and reassurance. Your doctor can offer guidance tailored to your specific needs and circumstances, helping you to feel confident and informed about your reproductive health. Remember, taking care of your body includes understanding and appreciating the natural processes that keep it healthy. Normal vaginal discharge typically has a clear or milky white color. It may have a slightly thin, watery consistency. Some women describe the texture as being similar to egg whites. The amount of discharge can vary from person to person. It can also fluctuate throughout your menstrual cycle. You might notice an increase in discharge around the time of ovulation. This is completely normal and is due to hormonal changes. The smell of normal discharge is usually mild. Some women describe it as being slightly tangy or musky. However, a strong, fishy or foul odor is not normal. this could be a sign of an infection and should be checked by a doctor. While some variation in discharge is normal, significant changes can be a sign of a problem. It's important to understand what these changes might mean and when to seek medical advice. Discharge can vary in color, consistency, and smell, and these variations can provide clues about your health. Pay attention to the color, consistency, and smell of your discharge. These characteristics can help you determine if something is off. For instance, normal discharge is usually clear or milky and may have a mild odor. However, any drastic changes should be noted. Any changes that are persistent or unusual should be reported to your doctor. This includes changes in the amount, color, or smell of your discharge. Your doctor can help determine if these changes are a sign of an infection or another condition that needs treatment. A change in color can be particularly telling. For example, discharge that is yellow or green can indicate an infection, especially if it is accompanied by a foul odor. This type of discharge is often a sign of bacterial vaginosis or a sexually transmitted infection. Yellowish or greenish discharge, especially when accompanied by a foul odor, could indicate an infection. It's crucial to get this checked out by a healthcare professional to receive the appropriate treatment and prevent complications. Similarly, thick, white, cottage cheese-like discharge is a common symptom of a yeast infection. Yeast infections are usually not serious, but can be very uncomfortable. They are typically treated with antifungal medications. It's also important to note any changes in the amount of discharge. An increase in discharge can be normal at certain times of the menstrual cycle, but a sudden increase, especially if it's watery or blood-tinged, could be a sign of an infection or other condition. A sudden increase in discharge, especially if it's watery or blood-tinged, could be a sign of an infection or other condition. This type of discharge can be associated with conditions like bacterial vaginosis, sexually transmitted infections, or even cervical cancer. It's important to seek medical advice if you notice these changes. Don't hesitate to seek medical advice if you're concerned about any changes in your discharge. Early diagnosis and treatment can prevent more serious health issues. Remember, your healthcare provider is there to help you understand what's normal for your body and to address any concerns you may have. Section 4. Common infections, causes and symptoms. Understanding the causes and symptoms of common infections is crucial for maintaining good health and seeking timely medical intervention. Several common infections can cause changes in vaginal discharge, which can be a key indicator of underlying health issues. Recognizing these changes early can help in diagnosing and treating the infections effectively. Bacterial vaginosis, or BV, is one of the most common vaginal infections. It is particularly prevalent among women of reproductive age. BV occurs when there's an imbalance of bacteria in the vagina. Normally, the vagina maintains a balance of good and bad bacteria, but when this balance is disrupted, it can lead to BV. BV often causes a thin grayish-white discharge with a fishy odor. This discharge can be quite noticeable and may be accompanied by other symptoms such as itching or burning. Yeast infections are another frequent culprit of changes in vaginal discharge. These infections are caused by an overgrowth of Candida fungus, which is normally present in the vagina in small amounts. When the balance of bacteria and yeast in the vagina is disrupted, Candida can multiply, leading to a yeast infection. This overgrowth can be triggered by factors such as antibiotics, hormonal changes, or a weakened immune system. Yeast infections typically cause a thick, white, cottage cheese-like discharge, along with itching and burning. These symptoms can be quite uncomfortable and may interfere with daily activities. Trichomoniasis, a sexually transmitted infection or STI, can also lead to changes in discharge. This infection is caused by a parasite called Trichomonas vaginalis. Trichomoniasis often results in a frothy yellow-green discharge with a strong odor. Other symptoms may include itching, burning, and discomfort during urination or sexual intercourse. If you suspect you may have an STI, it's crucial to get tested and treated promptly. Early detection and treatment can prevent complications and reduce the risk of transmitting the infection to others. Regular checkups and practicing safe sex are important steps in maintaining sexual health. Section 5. Beyond infections. Other factors affecting discharge. Infections aren't the only things that can affect your vaginal discharge. Other factors such as allergies and irritations can also play a role. For example, some women are sensitive to certain soaps, detergents, or feminine hygiene products. These sensitivities can cause irritation and inflammation, leading to changes in discharge. You might notice itching, burning, or a change in the color or consistency of your discharge. If you suspect a sensitivity, try switching to hypoallergenic products. Certain medications, such as antibiotics, can also affect the balance of bacteria in your vagina. This can sometimes lead to yeast infections or other changes in discharge. If you're concerned about the effects of a medication, talk to your doctor. Section 6. Hormonal influences, menstruation, pregnancy, and menopause. Hormones play a significant role in vaginal health and discharge patterns. Throughout your menstrual cycle, hormonal fluctuations can cause variations in the amount and consistency of your discharge. It's normal to experience an increase in discharge around the time of ovulation. Pregnancy also brings about significant hormonal changes that can affect discharge. Increased blood flow to the pelvic area during pregnancy often leads to a higher volume of discharge. This discharge is usually thin, milky white, and odorless. As you approach menopause, hormonal shifts can cause a decrease in estrogen production. This can lead to vaginal dryness and changes in discharge. The discharge may become thinner, and you may experience vaginal dryness or irritation. Section 7. When to seek help. Recognizing warning signs. While most changes in discharge are harmless, some warrant medical attention. It's important to be aware of the warning signs and seek prompt medical advice if you experience any of them. A sudden increase in discharge, especially if it's watery, blood-tinged, or foul-smelling, could indicate an infection. Similarly, thick, white, cottage cheese-like discharge, accompanied by itching and burning, is a common symptom of a yeast infection. Pain or discomfort during intercourse, pelvic pain, or bleeding between periods are also red flags. Don't hesitate to contact your doctor if you experience any of these symptoms. Early diagnosis and treatment are essential for preventing complications.
I will never stop appreciating your support. Smash that like button, hit subscribe, and share the love. Let's grow this amazing community together.